Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us here for another segment. We're going to be speaking with Dr. Phillip Gomez. He's CEO at SIGA Technologies, and he's joining us here on the program to tell us a little bit about the field of health security and talk a little bit about whether or not we are ready for the next pandemic. Welcome to Health Professional Radio, Dr. Phillip Gomez.
Thank you for having me.
Give our listeners a bit of background about yourself, and then let's talk about this health security industry.
Absolutely. So thanks. So I am a chemical engineer by training. I grew up in the pharmaceutical industry and spent a number of years at NIH at a place called the Vaccine Research Center, and was part of the team that made a SARS vaccine and Ebola vaccine as part of those outbreaks, and have been involved in health security for over 20 years. So thanks again.
Now, health security, we've all have visions of security, the security guard, the police officer, the soldier. What is health security other than guarding someone's health information?
Yeah, so it's come to mean the field where we're worried about diseases and infectious diseases that don't occur all the time. So things like pandemics like COVID-19, things like purposeful release of a chemical agent as part of a terrorist attack, or even an infectious agent like Ebola that comes. And so there are things we need to prepare for, but they're not things we're going to use all the time. So products like ours, we develop, we put on a shelf, and we hope we never use, but we're sure glad we have it if something has a outbreak.
Now, we're in the middle, well, I don't know if it's the middle or what, but we are in the midst of a pandemic as we're speaking now. Obviously, we weren't as ready for such an occurrence as I guess maybe we should have been. Are we ready for the next one, and what could the next one possibly be?
So it's a great question, and it's a mixed answer. So I think there have been great technological strides that have been done to get us ready for this pandemic. So I was part of the team that developed the SARS vaccine, and I was at NIH at the time, and that was developed from identifying the virus to getting in the first clinical study in 18 months. Mm-hmm. This time around, we've done it in 3 months. So clearly the technology and our ability to advance vaccines has gotten better. The challenge is, quite frankly, we haven't focused enough time and money on getting prepared. So even this time around, we found out there wasn't enough in the stockpile, and that's something that many people have talked about addressing, but quite frankly, we haven't. So we have a toolbox that's much better. Technology is helping us, but we do need to spend more and make sure there's enough in the stockpiles when we do have these types of outbreaks.
You briefly mentioned a bioterror attack. This was not that. The Spanish flu was not that, but that is a possibility. Are we ready for that if it should come to pass?
Yeah, so the good news is the U.S. government has focused on this a long time. Since the early 2000s, they've accelerated it under a new organization called the Biomedical Advanced Research and Development Authority. And they've developed, with industry like us, over 50 new pharmaceuticals and vaccines, drugs, diagnostics to address the types of things that might hit in a bioterror attack. Mm-hmm. The bottom line is, though, that unfortunately we've developed a lot of them, but they aren't all in that stockpile at the levels that would be needed if there's an outbreak. So we have a pathway to get there. We need to continue to focus on it, but there's certainly a lot more to do.
Now, as I said, obviously this is not a bioterror attack. This is, an accidental thing. But if an attack were to occur, it's going to be something very deliberate, and it's going to have a deliberate set of destruction. Are we prepared for something or someone that is deliberately trying to take us out?
Yeah, so the answer is partly. So a great example of this, and it's been brought up by a number of people, Bill Gates in some recent interviews was asked what he worries about after a pandemic, and it is something like a bioterrorism outbreak. So we work on smallpox. Smallpox, unfortunately, is one of the leading threats that people worry about with something like a bioterror attack. It's been synthesized. The cousin of smallpox, horsepox, was synthesized by an academic group in Canada. They showed how you could synthesize a virus like it and release it. And smallpox, unfortunately, would be a much worse pandemic than COVID-19. The fatality rate is 30%. It spreads much easier. And although it's eradicated now, it could come back very rapidly. The good news is there is a vaccine. We make a drug that's stockpiled to treat smallpox. But again, we have to make sure we have enough of those items in a stockpile so if there's an outbreak, we'd be prepared. And the real challenge is the U.S. has done preparedness, but globally we're not prepared. So the fear would be something like smallpox would come out and create a global pandemic very rapidly.
In the field of health security, what about early detection to determine whether this is an isolated incident, whether this is a pandemic, or whether this is a deliberate attack? And are we willing to share that with others to help them as well to identify early on what the situation is in order to better combat it?
Yeah, I think the answer is there. We have some pieces in place. There are biosurveillance networks and there are programs to collaborate internationally. Because to your point, when something pops up, we want to know wherever on the globe it pops up because it only is a plane ride away from the U.S. So there's much more we need to do there. But to illustrate the challenge, so for example, in smallpox, you're asymptomatic, you have no symptoms for 14 days. So if there was a release of a virus, there's been many tabletop exercises that people have done to plan for something like a smallpox attack. And unfortunately, with asymptomatic symptoms, people would get on planes, travel around. You could have it seeded in many parts of the world very quickly. And so that surveillance network becomes critical.
When there's a mutation that occurs, like that has been talked about in COVID-19, SARS, others, if there's a bioterror attack, are those components engineered to mutate during the attack, after the attack, as people are trying to recover? Is there something to combat that within health security?
Yeah, so I think, having a layered approach is important for any ability to respond to infectious disease. So having tools that have multiple items are important. I think, though, even in bioterrorism, Mother Nature provides a roadmap that's pretty powerful. So there is a lot of debate in the field. Would someone try and engineer, a pathogen that's worse than the natural one? But quite frankly, the natural pathogens that people worry about, anthrax, smallpox, tularemia, plague, those are pretty bad pathogens to begin with. So it's probably more likely people will focus on what's already been proven out in the field by Mother Nature without having to engineer it with additional items. Maybe you could ask the question one more time. I'm sorry, I didn't quite get the flow of it.
As far as things to combat a virus or something after the attack, is that development on the same track, fast track, once you identify the virus?
Yeah, it's a great question. So in the field of health security, the good news is we know there are families of viruses that are potential threats. And it's not an infinite list, but it is a long list. So we work, for example, on smallpox, but that's part of orthopox viruses. So we can anticipate what might be released. We can work on therapies and vaccines in parallel in anticipation of that. So hopefully by the time it's released, we have some countermeasures developed, and more importantly, we have enough of them that should there be an outbreak, we'll be prepared and be able to distribute them. So it can definitely be done in advance. It can be done in parallel with the concerns around what the health security threat might be. And that's what, I will say our partners in the U.S. government with us have been doing for now well over 20 years and trying to anticipate those things and develop them in parallel.
Dr. Gomez, thank you for joining us here on Health Professional Radio. Our listeners would like to get some more information about SIGA Technologies. Where can we go online and get some more?
So you can go to our website, www.siga.com, SIGA.com. Thank you so much for your time.
Great. Dr. Phillip Gomez, Ph.D. and CEO at SIGA Technologies. Thank you for joining us.
Thank you. Have a good day.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.